Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Welcome everybody to the webinar co-hosted by Worldview and Axxess with a special guest from Boston Home Health Aides. This is how a home health agency simplified the orders and accelerated their response times with one seamless integration. So first, I wanted to introduce myself. I'm Nolan Craig, sales executive at Worldview. I also have Laura Barnett with me. She's the VP of Operability and Sales at Axxess. And then we have Jason Gauthier, who's the Assistant Administrator and also the Operations Manager at Boston Home Health Aides. So welcome again to Laura and Jason as well. What we're going to do as part of this webinar is we're going to first start with Jason's going to tell us a little bit about Boston Home Health's experience with Worldview and bringing them on to their Axxess platform. Then we're going to jump in. Laura's going to tell us a little bit about Axxess for those of you who don't know, and then I will give a brief overview of Worldview as well. Listing some of the major benefits and reasons that you would move forward with our platform. Again, we'll save some questions for the end, so feel free to use that panel on the right-hand side. You'll also notice we have the PowerPoint deck as a handout in the handout section as well. All right, so first, again, let's jump in, and I want to introduce Jason again. And Jason, why don't you share a little bit about your experience at Boston Home Health Aides and what brought you to adopt Worldview and the Axxess platform?
Thank you very much, Nolan. I just want to say good morning, Laura and Nolan. Thank you for giving me the opportunity to speak about the software. So as far as the experience went, both Worldview and Axxess were extremely responsive during the implementation process. Once the contracts were signed for the service implementation, meetings were scheduled shortly thereafter, and Worldview assigned us a 3-person team to guide us through the implementation process. After an initial discovery meeting was held, the implementation team got to work in recognizing our specific needs and customizing the Worldview system to account for our processes. Worldview and Axxess both coordinated a go-live date, and Worldview handled the switching over of our electronic fax accounts to their system, and it was completely seamless. No disruptions whatsoever. Worldview provided personalized training, which occurred before the go-live date on the operation of the software, with all the necessary operational knowledge provided, and they also offered plenty of time for our additional questions and concerns and to make sure that we were fully trained on the operation of the software. Worldview also provided recorded video of the training for onboarding of future operators, which was great. Once the system became active, we were trained and ready to go, and everything just worked, seamlessly. We're now able to clear our orders to be sent queue and Axxess daily, with orders being sent to the providers much faster. They are more relevant to the time period, and we've seen an increase in timely return documentation. Also, the time saved in actually faxing and tracking has allowed us to recoup that time to be used for the recovery of orders that are not being returned for many various reasons, such as changing providers, changing fax numbers, or other issues which would keep a provider from signing our orders. The improved process has also eliminated human error, which can occur when manually uploading the documentation back to Axxess, such as uploading the documentation to the wrong task or even to the patient charts, which has been a problem in the past, which no longer is a problem with Worldview doing all the work for us. On average, we fax about 200 to 300 orders per week. Year to date, we faxed over 11K. Our signed order compliance as of today, year to date, is 82%. This system has detailed reporting functionality, which lets you parse and drill down through the information to make determinations such as returned signed order statistics by providers, We can identify physicians who return on the first fax through 4 or additional faxes, which lets us focus our marketing and recovery efforts to target non-compliant providers with the necessary education and to help us build a better relationship with them. It also lets us age our outstanding orders to make it easy to prioritize recovery activities and sort by outstanding order types, such as the individual order types, such as physician orders, plans of care, summaries. We can sort by provider or by patient. And then additionally, all of this information can be exported to Excel for additional data modeling where needed. So it's really helped us turn this process around 100%. We went from somewhere between a 40% compliance rate to less than 40% on our quarterly clinical record reviews on average, to the point that we're over 82%. We're already seeing the fruits of this turnaround on Medicare ADR audits and Medicaid third-party liability audits. Orders in the charts are no longer an issue for us. So it's really helped streamline this. And, being a smaller home health agency with a smaller administrative staff, this has freed up our staff to focus on recovery of orders that aren't coming back, as well as other administrative processes that need to take place on a daily basis. So it's definitely taken a lot of work off of our hands. It's like having additional employees work for you.
That's awesome. Great. Thank you, Jason, for sharing that with us. Let's talk a little bit, let's transition a little bit to Axxess and the Axxess ecosystem. Laura, if you're able to jump in here and give us a little bit of an overview.
Absolutely. Thanks, Nolan, and thanks, Jason. Delighted to be here with you guys today. Just to give you kind of paint a picture of what Axxess is and what Axxess offers. Obviously, we have a huge ecosystem, which includes at its core our EMR platform. So our home health solution, our home care solution, our hospice, and now our palliative solution as well. Additionally, we also offer patient engagement services. So, when you hit that 60 patient census mark, you, by Medicare requirement, you're going to be surveying those patients and assessing the quality of your care. So we provide that as well. From an interoperability perspective, and certainly I know we don't have a ton of time to talk about this today, but I'll dive in just a little bit because that's kind of the root of today's conversation. We focus our interoperability solutions around a clinical bucket, around an operational bucket, which certainly is where Worldview sits, as well as financial tools. And in addition, we also have a hospice tools as well. We also have a patient and family portal. We have our staffing and scheduling solution, which you may have heard about, called Axxess Care, which essentially is sort of an Uber or a Lyft of home health. Organizations that have home health visits that need to be filled can post those to a platform. Clinicians can then apply for those visits. You can select which clinician you'd like to work with. And therefore, you're able to maintain those referral sources or get those visits covered and avoid LUPAs in the process, which we all know we want to be doing. From a mobile perspective, we have device agnostic mobile apps. So that means that it's going to work on your Apple phone, it's going to work on your Samsung phone, etc. Regardless of what kind of operating system you have, our apps will be supported on that. So from a point of care perspective, you're able to go into the home and do your documentation on your phone, super easy, super simple, and you can focus more on the patient as opposed to hauling in a laptop. We also have electronic visit verification, which we know is crucial these days, as well as offline capabilities. So if you're out in a rural area, we're able to capture that documentation that you're working on. And then as soon as you're back into an area that has cell service, we're going to pull that information from you. You don't have to force sync. From a revenue cycle management perspective, we offer billing services, Medicare, we work with all payers. And in fact, we're one of very few organizations that is a network service vendor, and we're the only EMR that is a network service vendor. So you can do your documentation, you can submit your claim, and it's going to go directly to Medicare. It's not going to have to go to a clearinghouse first and then go to Medicare later. So we're going to expedite that process, which is important for your cash flow. From a business intelligence perspective, we offer a data warehouse filled with dashboards which provide you insights into your organization's growth. We also have a user community, kind of a Facebook for our users essentially, but it's a community where you can share best practices, ask questions, get tips. And then one of our newest offerings is our certification program. We know that training and education is a huge part of addressing some of the staffing concerns that are really top of mind for a lot of organizations. And the Axxess certification program provides training not only in Axxess solutions, but in industry solutions overall. So a big look at this ecosystem, a very brief look certainly, but we want to be able to be the solution that you're going to log into first thing in the morning, and you're going to be able to stay there all day and log out at the end of your shift, whenever that may be. But we want to make sure that we're giving you everything that you need in a one-stop shop. So we're really delighted to be able to partner with Worldview and create a great integrated platform for you, and delighted to work with Jason and his organization and many, many others who are seeing the tremendous value of having Worldview's capabilities integrated with Axxess.
Wonderful, wonderful. Yeah, there's a lot packed into that deck, but appreciate you walking through that.
Happy to do so.
I want to talk a little bit about Worldview and who we are. Essentially, what we do as a business is we actually help other businesses achieve their efficiency and achieve their highest levels of productivity. And we do that while trying to maintain the highest levels of service. We always like to look back and reflect on the gold standard of service that we've had throughout the years. And we've actually been a company for over a couple decades now, believe it or not. And one of the things that we do, we've got these core focuses that I've got on the left-hand slide here. We essentially like to think of our clients as partners, and we do that at the very beginning stages when we first work with any of you. We'll try to understand your business, and we'll take a consultative approach to making sure that we know what you do and how you operate, and if there's opportunities for us to jump in and help you guys make yourselves more efficient. We're a document automation platform, and so we're really focused on that return on investment, and essentially helping you guys achieve your greatest success out of our system. So even as we pass the solution that we've designed onto our implementation team, I think Jason mentioned a few times how well our implementation team does, understanding and deep diving what you do as a business, so that we can jump in and we'll make the recommended configurations based off of what we think you'd see the best results out of. That carries into our customer service as well. Beyond the implementation and beyond the initial push, he mentioned training for you, and that's one of the biggest core values that we have, is being able to kind of use that white glove service and white glove treatment to make sure that you're understanding the solution and your team is understanding the solution as well as possible. If you don't understand it, you're just not going to use it to its best capacity. So how we do all that, or what we actually do, I want to dive into a little bit more. So Laura mentioned, we've got that operability, or that operations end of the interoperability section from Axxess. And really what we like to do with any EMR that we work with, but especially Axxess, has been great at integrating us seamlessly into their solution. And so we've got that tight integration to where we're able to pull patient data from Axxess securely, and we also pull order information from Axxess as well. And with that information, we're able to streamline the outbound process, where we're sending orders to physicians, and we're reducing that turnaround time for those orders to come back in signed. And by automating that process, and also by keeping it consistent, making sure that nothing really drops off of your radar, we're able to get those orders back in and improve cash flow for your organization. On the inbound side, for all of those faxes and medical records and charts and everything that needs to go into the patient's chart for Axxess, there can be a lot of documentation that's floating around. So Jason mentioned about 200 orders per week that go out. Well, that's roughly as many that will come back in, plus more with any other medical record beyond an order. And so that becomes really cumbersome to deal with and to process for really anyone. And our system helps automate a lot of that to be able to bring it in. And we can actually do some optical character recognition to read and separate those documents automatically, which is usually something that needs to be done a little bit more manually. So we're reducing the amount of time that it takes for your individuals to bring those into the Axxess chart from about 2 to 3 minutes on average to down to about 10 seconds on average. Which you can see, and Jason mentioned that really big savings that you'll see on time from our system as well. We have organizations today that have been able to reduce the amount of full-time staff that they have focused on the document management and medical records processes from about down to about 750 patients to one full-time employee. So as you can see, there's a lot of efficiency that you can gain from this. And if you're really focused on productivity, if you're really tightening up, and in a lot of cases you're working on growing your clinical staff rather than your admin staff, then that's where Worldview can help out quite a bit. I mentioned already the inbound side and also physician orders. We also have a mobile application that deals with the documentation aspects of what your nurses or clinicians would do out in the field. And so being able to bring back documentation and process that and associate that with the patient record, we're able to do. We also have wound capture functionality and wound measurement functionality within that. And then a lot of agencies that we work with actually use a secure messaging platform that's separate from all of this. We've actually been able to bring that into our tool so that you can kind of use us as a one-stop shop and not have to deal with all the other vendors that are out there that offer that type of functionality. Most recently, we've actually built out a medical records request workflow that deals with bringing back those payer requests or denials or HIPAA requests and tracking those outside of a spreadsheet or a notepad like we've seen with a lot of other agencies. So if you haven't checked out our medical records webinar yet, we've got that out there as well. Please do reach out and we'd love to talk to you about that a little bit more. Beyond that, I wanted to open up the floor a little bit and see if we've got any questions from the group. Now would be a great time to pose those to us. And if you feel like you don't want them asked on the webinar here, feel free to reach out to us directly as well. I've got some contact information on the next slide.
I'm not seeing any in the chat box at the moment, but folks may still be thinking and typing. So,
okay, I've got a couple here that I have for Jason actually. Jason, what were the pain points that drove you to seek out a content management solution?
Well, it was just a very cumbersome process. Even if you're using an electronic fax system, such as fax through email, as opposed to physically running paper through a fax machine, you would still have to download the documentation from Axxess, drag and drop it into an email, type out an email fax cover, or use an email template. We created a spreadsheet whereas we were faxing plans of care and payer-specific documentation where we were noting, the person that faxed it out, the date of the fax. There were calculations on the sheet to track the age of the documentation. So just getting them out the door was a cumbersome process that we could never keep the queue clear on a daily basis. If we were able to get 100 out a day, there was still 200 or 300 waiting in the queue for the next day. So we were always kind of in a backlog situation, just getting them out the door. So this system allows us to send everything out simultaneously. As people that sign up for the service will come to find out, it can be configured where the faxes can be sent out from the the to be sent queue, or they can be sent out automatically upon QA review. We opted for the to be sent queue so that some admin staff could have a final look at the documentation before it goes out the door. But just, you know, the hours per week that were spent, you know, at least 20 plus a week, and not even meeting the goal of getting them all out the door on a weekly basis. I mean, that issue is gone. And again, you know, we're able to really put the focus on the ones that aren't coming back for a myriad of reasons that are not related to, you know, transmission issues.
Awesome. A question also came in, does Worldview work with Mac computers? So the answer is yes. We actually do have a couple ways to access Worldview. One of which is being, you know, we have a client that actually has quite a bit of functionality that's included with it, but then we also have a way to access it through a web client as well. So anywhere you can access a web browser, you can actually work with Worldview. I have another question here. I'm curious if there is a capability via the Worldview mobile app for providers to sign orders electronically on the mobile device. So yeah, actually, one of the functionality pieces that we included into it was the ability to download those orders we're getting from Axxess onto the app itself before you go out to a visit. So in a lot of cases, if you have a physician, maybe like a physician relationship rep, or in some cases, you know, you're working directly with some of the hospice MDs, you have the ability to bring that onto the tablet, whether, you know, that's an Android device or an iPhone or an iPad. And then you can actually have the physician review those orders directly on the iPad or tablet, and then sign off on those electronically. Then once they're submitted, you have the ability to attach those to the chart rather than having to deal with, you know, printing them out, bringing them back in at the end of the day, just to, again, increase that turnaround time. I have another question here. Are the orders returned by the provider via the same system? So yes, we're sending them out once we receive them from Axxess, and then based on that cover sheet that we configure as part of your initial implementation, they'll send it right back to that same number. We actually work on a porting process to bring those lines into Worldview so that we're able to do that recognition and able to do that automatic separation. So there's minimal QA that would need to be done, but we still do provide a QA queue for you to be able to check and make sure that the physician did sign it and didn't just send it back blank, or maybe they marked it up before they sent it back. So those are steps that you can take before checking it in and then sending it over to Axxess to the orders console. I did have one more question here for Jason again. What were some of the reasons that you guys chose Worldview over maybe some other options that you had?
Well, you know, when we started to hear about Worldview through Axxess, they were the only company that we had heard of at that point in time. So that piqued our interest in the service. You know, it was Axxess's advertisement for the integration that really connected us with you folks.
So can I jump in and say you're welcome at that point now?
Yes, absolutely. Yeah, we certainly appreciate it.
Well, we're delighted to be able to bring two great organizations together, for sure.
Very much, thank you. Okay, and then I had another question here. This one looks like it's for us. It's just asking about what is the timeline and resources of implementation, and what does that look like? And Jason, you kind of hit on this a little bit in your presentation, but Worldview is very quick to turn this around. I'd say we typically say it's about a 4 to 6 week implementation once we kick off. we've got a few different individuals that really have streamlined the process. And so we'll do a lot of discovery up front with your team. And then it's all us from that point forward, making sure that everything is set up and configured the way it needs to be. As far as lift from your organization, just being available to that discovery, providing that feedback, providing that input, we usually ask for about a weekly call in that 4 to 6 week period. But then it's just a matter of making sure that we work with you guys on porting those lines over into Worldview and then setting up the software on PCs. So it's a very easy click once type implementation, and then we'll get you into the system and logged in and comfortable with it before we do training, and then you're live.
I can attest to all of that. It was a really easy implementation process, especially people that are concerned about their fax lines. You know, Worldview handles the porting of your company's individual fax lines right into their system, so you don't have to change numbers with your providers. You know, all of those numbers can still be used, and again, they handled it 100%, and it went very seamless. We had no interruption of receiving you know, faxes through our main line at all. It worked out very well.
Awesome. Yeah, I'll be sure to pass that feedback on to Amy from our implementation team too. I'm not seeing any other questions here. Laura, do you want to double check that for me?
I happily will. I'm not seeing any. No, I think
Okay,
I think we got everything answered.
Awesome. Well, that being said, I do very much appreciate everybody's time today. We're going to go ahead and end the webinar. Like I mentioned, we're going to send the recording out once we're done editing, and then follow up with you guys individually as well. So if you have any other questions that maybe you didn't ask, feel free to reach out to me. And I hope you all have a wonderful rest of your day.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on Software Advice. You can watch more on-demand training videos through our industry-leading help center or at axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.